My name is Mark Langold, and I specialize in plastic surgery.
When did you first realize you wanted to become a surgeon? Was there like a defining moment?
Yes, the first time I realized that I wanted to pursue career in surgery was in my 4th year of medical school. And it really started when I did my general surgery rotation and then had some experience in plastic surgery. And I really felt that plastic surgery was my calling.
So why plastic surgery? And more specifically, like breast augmentation and facial aesthetics?
I was drawn to plastic surgery due to its artistic nature. I was always into art, and I like to think outside of the box. I feel like plastic surgery is a very challenging specialty. You always have to have kind of an open mind. There's a lot of innovation and improvisation. Every patient is different. They need a different approach, and plastic surgery is more of an art rather than science. I say it all the time, and I think what that actually means is that there's not a specific measurement or a book you can read that will achieve the desired result the patient wants. A lot of it has to do with the surgeon's creative mind and designing something that kind of fits the overall patient's appearance, whether it's breast, nose, whatever we're working on. It has to fit. It has to be the right fit for the patient. It has to blend with the other features and overall create a flow. So that, to me, that's more of an art rather than scientific, more an artistic approach rather than a scientific approach that would create the look and kind of like the almost like a sculpture that we're going for.
Was there ever a moment early in your career where you thought, this is what I'm meant to do?
Yes, I think so. I think it's one of those things where with a lot of our jobs, a lot of our passions, does it start out where you kind of, is it something you want to do to begin with, or something you start doing and you fall in love with it? Well, for me, I love the idea of doing plastic surgery and something that I always had a passion for. However, I think when I actually got into it and started my residency and had experience with a lot of the procedures in plastic surgery, like a lot of breast procedures, like breast reconstruction, breast augmentation, I really felt like this was the specialty that I was meant to do and my passion.
So you said you did your residency, and did they like have you in a room for different procedures, or was it just like heavily focused on breast? And then what made you choose that residency?
The plastic surgery residency is essentially broken down into 6 years, and you start out experiencing a lot of the procedures from day one. So you get exposure to different procedures all over the body, and my residency was definitely heavy into breast surgery, where I got to see and operate on a lot of different patients, and we had to address a variety of complex problems related to either patients that had absence of breasts or wanted enhancements for cosmetic reasons.
And you started your medical career in Florida, right?
Yes, I did start my medical career in Florida after my fellowship.
Okay. What brought you out there originally, and then what kind of experience did you gain during that time?
Yeah, excellent, sure. So one of the main reasons I moved back to Florida after my training was because of my family. I wanted to be close to my family. I felt like in Florida, I got to experience a lot of diversity. I saw patients from different backgrounds. I saw very complicated surgical cases related to breast reconstruction, related to cosmetic surgery that I don't think I'd get to see other places, just because I was part of a tertiary care center that attracted a lot of patients who had nowhere else to go.
Where did you complete your medical degree, residency, and any fellowships?
Sure. I completed my medical degree at Florida State University in Tallahassee, Florida, and then I went on to do my residency program at University of Nevada School of Medicine, which is at the time was based out in Las Vegas. This is the plastic surgery program, so I spent 6 years there. And then in addition to that, I wanted to further my training by doing a microvascular reconstructive breast reconstructive fellowship in Rochester, New York, followed by another fellowship in body contour and cosmetic surgery in Gainesville, Florida. So I have about a 20-year experience in plastic surgery.
What board certifications and professional titles do you hold today?
Sure. So I'm currently, I'm a board certified plastic surgeon. The only board certification in plastic surgery that's actually recognized by the American Board of Medical Specialties.
How hard is it to get that?
Well, it's a very extensive process to be board certified in plastic surgery. To be board certified in plastic surgery, the requirements are completion of plastic surgery residency, which is anywhere from 6 to 8 years. And in addition, you have to spend 1 year in practice doing cases on your own, and then they have to take a written as well as an oral exam in plastic surgery that essentially tests your competence, which includes both clinical competence as well as your knowledge base in plastic surgery.
What inspired you to move from Florida to Idaho and open up your own practice here?
After being employed for approximately 8 years, my brother and I, my brother is also a surgeon, we decided that we wanted to have our own business together, and Idaho was a place that was dear to our heart. We have some friends here, we have relatives here, and we really enjoyed the area, including outdoors, including the weather, and just the growth that we saw here in Treasure Valley. And so this is something that really attracted us to the area, and we love it here.
What was it like starting your own practice in a new state?
During the initial phases of the startup, it was definitely challenging. One of the hardest things was just getting adjusted to the environment, getting to know the right people in the industry, and creating our brand.
How has having your brother alongside you shaped the culture and mission of your practice?
I think it's been a blessing. I mean, we always dreamed of working together. Having my brother by my side is awesome. I mean, he is my best friend. We work really well together. I think our personalities mesh really well. I think we really help each other out. It's a mutually symbiotic relationship where I think my practice, his practice both have benefited from having each other on board.
Have you guys received any awards, media recognition, like Top Doctors, Best Plastic Surgeon, any local features, anything?
Yes, we have been recognized in 2024 by Boise Favorites. We were one of the winners, and our practice was recognized as one of the best cosmetic surgery practices in town.
Why do you often recommend over-the-muscle placements?
I do prefer over-the-muscle placement for breast augmentation if the patient's anatomy permits. And the reason being because I feel like the recovery is a lot faster, the results can look more natural, and I think long-term patients can benefit from not having their muscle cut or compromised.
I know there's some myths about the negative side of over-the-muscle placement. Can you call those out and then tell me why it's a myth versus a fact?
Sure. One of the myths that I hear quite frequently is over-the-muscle placement produces a higher rate of capsular contracture, and I think the newer studies have shown that's actually not true. A lot of it has to do with technique, and with the current implants, I think we're seeing a lot better results than we used to see, back in the day 10 to 20 years ago when the implants weren't as good. The other myth is that the patients will always see or feel the edges of the implant, they'll have more rippling, which sometimes can be true in patients who are very thin and have very little amount of tissue covering the implant. But in majority of patients that have a good soft tissue coverage, that we don't see that at all.
What steps do you take to minimize the scarring?
So when it comes to breast augmentation, the scars are minimal. We make a very small incision, very small cut, kind of at the base of the breast, which is approximately anywhere from 3 to 4.5 centimeters, and then we have the patients tape the scar for a period of time, and then we use silicone gel and silicone tape in addition to that to minimize scarring. Moreover, for patients with bigger scars, for example, after tummy tucks, a lot of times we'll encourage patients to do microneedling, which we do offer, as well as laser therapy.
How do you ensure that results look natural and proportionate?
To ensure that the results look natural and proportional, we really make sure we use state-of-the-art technique. We have good patient selection. When it comes, for example, to breast augmentation, we make sure that the actual implant matches the overall breast diameter and shape, and it's not over the top. We also make sure that any procedure that we offer is not overdone, making sure that not too much or too little skin has been removed. We make sure that all the measurements have been done prior to surgery to ensure symmetry, shape, and proportions.
What do you typically say when someone's like, I think I want X amount of cc, but I'm just not sure, and you can already spot like that might not be the best result for them? How do you go about navigating that?
That's a very good question. I think most patients are very reasonable, and they are clear about their goals. However, once in a while we do run into situations where patients want a certain look that's impossible to achieve. And at that point, we just have an honest conversation and kind of discuss what's possible, what's not possible. And I'm completely frank with the patients. I'm completely open, and I tell them what can and cannot work in my hands. And at that point, the patient either agrees or goes somewhere else. And just because if I can't accomplish something that patient wants, I'm not a good fit. My goal at the end of the day is to produce a safe, reliable result that would fit your body perfectly and that will produce a long-term successful outcome.
What's the typical recovery time like, and what makes yours smoother than average?
The recovery after procedure, for example, like breast augmentation, is not super long. A lot of times my patients are pretty much back to normal in about 3 weeks. I think what makes the difference in our practice compared to some other practices is that we do primarily over the muscle techniques where there's a lot less swelling. The patients a lot of times are able to get back to the gym in a week and don't have this prolonged tightness and pain. On the other hand, for rhinoplasties, we recommend a closer approach. And the reason I prefer that approach is because the recovery is also a lot faster and there's a lot less swelling, and patients feel like their noses look normal after only a few weeks.
What steps do you take to minimize the scarring for that?
To minimize the scarring after rhinoplasty, we make no external incisions on the nose. We also make sure that the incisions, even inside the nose, are minimized. And for a lot of patients, we're able to do the entire operation through 2 small incisions inside their nose. There's this general thought, sometimes even among surgeons, that open rhinoplasty is better or can achieve better results than a closed operation, than a closed rhinoplasty. I think this is a myth, and the reason being because the initial thought is that with an open approach, you can actually see the nasal skeleton, which is bone and cartilage, better than you can with a closed approach. However, in reality, our nasal skin is not like a tablecloth. So just because the surgeon can see the skeleton better and can see every little detail doesn't always translate in a better result when a patient is healing. In reality, a lot of times during a very aggressive open rhinoplasty, a lot of the normal anatomy and normal structures get damaged and destroyed. And so the healing actually becomes less predictable, and you're more likely to experiencing significant changes as the healing occurs and possibly have a suboptimal result.
How do you ensure the results look natural and proportionate with rhinoplasty?
So one of the advantages in the nasal or closed rhinoplasty is that a lot of times the results are seen on the table. Since we leave the skin envelope intact and we don't, so to speak, deglove the skin from the nasal skeleton, I'm able to see live the results. So I'm able to see the results during surgery as I'm adding or removing cartilage. And so that way we can make sure that before we leave the operating room, the results look as smooth and natural as possible without the guesswork of hoping that the healing will create the results what we want, as you do in an open approach, where you're kind of hoping that with the healing you'll get the result that you're hoping to get. And you don't really know what it's going to look like.
What's the typical recovery time like, and what makes your process smoother than the average?
So the typical recovery time after rhinoplasty is anywhere from 3 to 6 weeks, depending on the person. I think with my patients, they feel like after about a month or so, they're pretty much back to normal. And again, I think it has to do with the less invasive approach to nasal skeleton, nasal skin. The less normal anatomy and less normal structures are damaged by the surgery, the faster the patient will recover. And I think you can achieve that with the closed, less invasive approach.
What do you think sets your approach apart from other plastic surgeons in Boise or the surrounding areas?
I think one of the differences you'll find with my approach to surgery is that I try to find the least invasive way to achieve your result. So we try to find the minimal invasive approach that will provide a shorter, smoother recovery to achieve your aesthetic goals. So by minimal invasive, I mean making less incisions if we have to, creating less scars, also limiting destruction of normal structures during surgery. So we'd only address the issues that concern the patients without trying to modify or operate on normal anatomy.
What are the most common types of patients you see?
My most common type of patients are usually moms that have had children and develop some loose skin in the process, potential after childbirth or aging. A lot of patients who had deflation of their breasts and want some enhancement, such as improved fullness, improved sagging. The other patients I see that are commonly seen in my practice are patients after massive weight loss that developed a lot of skin and they want body contouring surgery. And then finally, patients that have difficulty breathing and or unhappy with the shape and contour of their nose. That's an additional type of patient. So that can be a different demographic of patients, anywhere from teenagers to older adults. I also see quite a bit of fitness competitors in the gym who are trying to look their best for the stage or just to feel their best about their bodies. So I do see a lot of folks from bodybuilding community, and those include both men and women. Yeah, and a lot of times the bodybuilding female competitors who kind of want to achieve a better balance and symmetry, and then the breast enhancement can sometimes improve their overall shape and presentation on stage.
What motivates most women to finally book surgery?
I think there's a couple of things that motivates women to finally book their surgery. That would include, obviously, trust in the process, trust the surgeon, understand that you actually listen to them and you can achieve the goals that they want to achieve. It's also a lot of my patients also have done a lot of research and kind of start to understand what the surgery involves and how I can improve their breasts or whatever body part they're looking for to improve.
What are some of the biggest fears or concerns your patients share before surgery?
So some of the biggest fears and concerns that patients have, usually about their results. It can include, do I really know what results that they're looking for? Are they going to look natural? How long are the results going to last? What about their recovery? So those things, I would say, it's usually questions about the results or recovery.
Why do you feel like Boise was the right place to establish your practice?
I felt like Boise was the right place because I felt like it's still not extremely saturated with plastic surgery, and I felt like I could come to the Treasure Valley, and actually my brother and I could come to Treasure Valley and make a difference. This area is still somewhat underserved. A lot of services aren't offered or offered in limited capacity, and I felt like a lot of patients go out of town, such as Utah, to get plastic surgery or other services that we offer. And so I felt like we could make a difference in the community and really help out.
What's your personal philosophy when it comes to aesthetic surgery?
My philosophy when it comes to aesthetic surgery is essentially achieving the goal that the patient wants. However, my main objective is to do it safely, preserve function, and obviously achieve their goal. However, I want to make sure that we create a result that will minimize complications, maximize recovery, and improve overall well-being of the patient.
What do you want patients to feel when they first walk into your office?
I would like my patients to feel comfortable when they walk into the office. I would like them to feel that they will be listened to and understood. I want them to know that we have the same goal, we're in the same team, and both my patients and I, we want to create a plan that they will feel comfortable with and achieve their results. After 6 months after surgery, I would love my patients to feel like I have made a difference, that they achieved the result that they were looking for, and we took really good care of them.
If a woman is nervous or unsure, what do you wish she knew?
It's okay to be nervous and unsure before surgery, but I do want my patients to know that we will take great care of them, we will listen to them, we will do our best to achieve the results that they're looking for. I have helped hundreds of women in Treasure Valley and beyond to achieve successful results.
What do patients usually say after their post-op review or follow-up?
Most of my patients are happy after the initial healing process passes that had certain surgery done, and they say, I wish I had done it sooner.
Do you have any transformation stories that really stuck with you?
Yes, absolutely. I have multiple stories of patient transformation. There's too many to count, and I can certainly share them one day.
What's the most rewarding part about helping women through this transformation?
I think the most rewarding part of helping women and men through transformation with plastic surgery is to see their confidence change and to see them become the best version of themselves. It's almost, I can't really influence the entire personality, and that's not my goal. However, what I see sometimes is patients undergo, I can see it in their eyes, they look more confident, feel more confident, and their quality of life improves. And that's, I think, the most rewarding part, is to kind of to see that and to experience that firsthand.
What should someone expect during the initial consult with you?
Anyone who comes in for initial consult with me should expect that they will be listened to, that we will consider everything they have to say and consider their goals, and we'll create the best possible plan to achieve those goals.
How many patients do you typically take on per month?
We take on approximately 30 or so new patients per month.
Since this isn't covered by insurance, what should patients understand about the investment?
That's a very good question. So cosmetic surgery is not typically covered by insurance and can get quite expensive. But however, what I tell patients, this is an investment for life. Number one, there's only one-time fee, and there are no extra charges after they pay their fee, which includes everything, including professional fee, facility fees, anesthesia fees, and so forth. And this is an investment in themselves. This is something in a good plastic surgery, good cosmetic surgery changes someone's appearance forever. I feel like it's hard to put a price on that, just because we're changing people's bodies and we are trying to improve their well-being and confidence.
When someone chooses you as their surgeon, what kind of experience should they expect from start to finish?
When someone chooses me as a surgeon, they should expect a very positive experience. I will guide them from start to finish through the process. They can think of me as a coach or their trainer, where we'll start by initially assessing their goals, examining them, and really coming up with a customized plan to achieve the results that they're looking for. I would hope that any woman or man that sees me for a consult walks away feeling that they were understood, that they were listened to, and that I was very genuine and open with what I thought is possible and my plan of care. Thank you so much for watching this video. If you feel inspired by this interview, please feel free to reach out. My number is down at the bottom of the screen. Give us a call and be happy to see you for a consultation.